So part three, talking about lower GI bleeding and common causes. And the number one cause, the big winner, is diverticular disease. This is diverticulosis, which is just meaning that you have the diverticula and they don't get infected, and diverticulitis, which means you have the diverticula and they are inflamed. And these are little finger-like projections that are going from the inside of the wall lumen or the inside of the tube of your GI tract and poking away from it. And this came about from basically increased pressure. So when you eat a low-fiber diet, the smooth muscles have to push that poop along. And when that happens, there are little weaknesses in that tube. And over time, and we're talking years and years and years and years, the weak parts of that tube will balloon out and create these little finger-like projections, and they literally balloon out, and they become weaker, and they're subject to trauma and can bleed when stool passes by. And so I've got a picture of what one of these look like, and you can see here, what I'm kind of circling around is one of those diverticula. It's just a little weak spot in the tube. And that's the area that's developed over years and years of having to push harder to move a piece of stool along. And it gets there from having eaten a low-fiber diet. Fiber adds bulk, it pulls water into your stool, and it makes your stool softer and easier to squeeze. So anything that makes it harder to pass stool makes it more likely that you're going to get those diverticula. And so they're just, because they're weaker and that little outpouching is easier to damage, it's just easier to bleed. If it's diverticulosis, it bleeds but hasn't gotten infected. If it's itis, things get stuck in this little area like bacteria and can become infected, inflamed, and filled with pus and nastiness. So how do you improve this? Well, eat a better diet, more fiber. If they get those little out pockets, those little weaknesses get infected, take antibiotics, and if it's bad enough, it's surgical removal of that part of your intestine. Another cause of lower GI bleeding are hemorrhoids. And these are swollen, large veins right below the surface of your skin. So instead of like being a diverticula where a weakness goes away from the opening of the tube, these are actually pointing into the tube. And these, instead of happening anywhere along the lining of your intestine from the small intestine or the large intestine, these happen in the rectum and your anus right before the stool comes out. And frequently these will actually kind of pop out when you go to the bathroom. And they're caused by high pressure and when you strain to have a bowel movement. So much like diverticular disease, they come about from having had a low fiber diet, and the treatment is the same. Improve your diet, eat more fiber, exercise regularly, because exercise actually does make it easier to have a bowel movement. And if they become a problem, instead of having full-on surgery, like to remove a significant part of your colon, you can actually have a minor surgical procedure where they will actually clip them. Like when people go in for a colonoscopy and they have a polyp removed, they don't have a whole portion of their colon removed, they can have a couple of these clipped and the bleeding stopped locally, and so you don't have to have a full-on surgical procedure. Another cause of lower GI bleeding is inflammatory bowel disease, ulcerative colitis, and Crohn's. And you guys did this already. The ulcers, the breakdown in the lining bleeds, and because you're in your colon and your small bowel, the blood progresses down the rest of the GI tract. And we've already done this part, so we don't need to discuss it further. The last one is a biggie, and I'll spend a lot of time here because this is colon cancer. It's important to know because when you get these tumors that stick out into your colon, they're susceptible to damage. And even though this isn't the number one cause of lower GI bleeding, it is the one we worry about the most.